Now, governors have convened an emergency meeting next week to discuss what they've termed as a series of underhand tactics by the national government to claw back devolution gains. The county chiefs have faulted the national government's attempts to undermining their efforts to realise devolution by taking over some of the key devolved functions, including health, housing and trade. Now, the latest feud being the rollout of the Community Health Promoters Project, where the national government plans to use in excess of 250 million shillings monthly as stipend to remunerate the county staff. NTV's Vincent Odwar tells us more.
The governors are accusing the national government of trying to take over certain devolved functions through the back door. The feud exploded last Friday when all the governors turned down an invitation by the Deputy President Rigathi Gachagua to attend his launch of the national government's time-paid payment to community health promoters CHPs at his current residence. NTV has established that after the governors failed to show up that morning, frantic calls were made to have them show up for the function at 3:30 in the evening, but they refused. They also reportedly refused to send their CHPs to the function, raising questions on where the CHPs at the function came from. Governors are raising concerns why the national government is hesitant to allocate the monies meant for markets development, get their input on housing project and those it is using to remunerate CHPs. Yet these are assigned counties' functions. Now COG says the severity of these transgressions is escalating daily through direct budget support for the devolved functions channeled through national government ministries, departments and agencies at the counties, and deliberate use of members of parliament to roll out these programs disregarding constitutional roles of counties. Friday, the government said it has released 3 billion shillings to pay the CHPs.
I want to send a passionate plea to our governors to very quickly also organize their part of the stipend.
For a while now, the national government has required the county governments to share with it half-half the stipend cost of each CHP at 2,500 shillings each. Yet there are counties that have been paying CHPs between 2,500 shillings to 4,000 shillings each.
Why is it that we have very many nurses who have been trained coming out of the nursing and medical colleges, yet we have shortage in our facilities? It is a question of affordability, it is a question of funding to health.
After the meeting, the council will give its position on the aforementioned issues. Vincent Odwar, NTV.